Well, welcome to the Testosterone Optimization Overview educational viewing. It is required to view this course for your consultation because it's important for you to have an understanding of how testosterone works and the options that are available to you. This is going to be about a 22-minute video, so I just need to get right into it. And it's important for you to understand the HPG axis and how the brain communicates to the testes to make testosterone, okay? So the hypothalamus, which is in the brain, communicates to the pituitary gland, okay? And you can think of the hypothalamus as the command tower, and it monitors the testosterone levels and releases gonadotropin releasing hormone and to the pituitary gland, and then the pituitary gland sends LH and FSH hormone signals in pulses to the testes, and the testicles, which are like the factories, is where testosterone and sperm is actually produced. So you can think of the testicles as the factory houses, okay? Over here on the right, you have your core players, testosterone, the leading actor in our hormone story, DHT, which is a potent derivative for your libido, estradiol, which is an important hormone. Men do need some estrogen. It's not just a female hormone. The ideal range for estrogen is going to vary based on who you're listening to. But just know that you do need a little bit. It's good for your bone health and it's good for your mood balance. And we are also going to talk about cortisol, which is a stress hormone that's made off the adrenal glands that is going to definitely affect your testosterone production. And it's very important to keep your stress and your cortisol in alignment, okay? We're going to talk about the two types of low testosterone next, okay? Primary hypogonadism is the testes are not responding to the brain signal. It's a factory problem. And secondary hypogonadism is the brain is not sending a strong enough signal. You can think of it as a communication problem, okay? There are treatment options beyond traditional testosterone, is what this next part is saying. Those would be enclomiphene, and that helps increase the LH and the FSH signaling in the brain. This is very good for our younger men, and it helps all three of these, enclomiphene, kisspeptin, and gonadorelin, all help preserve fertility, okay? So they're very good for increasing the LH and the FSH and the gonadotropin releasing hormone in the hypothalamus and the pituitary, okay? So they all work up in the brain, okay? Couple things to also note on the right-hand side, between 8 and 10 a.m. is when your testosterone is the highest. That's why maybe you can perform in the morning. That's also why we have morning wood. That's also why libido and maybe performance is not as good as the day goes on, because testosterone does account for about 20 to 30% of erectile dysfunction. So if you're able to perform better in the morning, this is one of those reasons why. When you're going to get your testosterone labs checked, this is also another reason why it's good to get it checked in the morning. Your levels are going to be more accurate in the morning, okay? Now, let's follow this down here. Key insight: men in their mid-30s with low T, low LH, FSH recover naturally through lifestyle changes. They can actually. Lifestyle changes, getting the obesity under control, smoking cessation, alcohol limitation, good supplementation and vitamins, and then maybe just using some of these options up here, the enclomiphene, kisspeptin, gonadorelin. Try to keep these gentlemen off true testosterone, because true testosterone can shut down the HPG axis, and we'll talk more about that, okay? Hormonal health is about rhythm, balance, and flow, the foundation of vitality. Okay, we want to keep in alignment with our circadian rhythm. Okay, testosterone across the lifespan in modern decline. Okay, natural decline 1% per year after the age of 30. Lifestyle factors that accelerate this decline. Well, I already touched on a few of them. Excess fat, poor diet, sleep loss and stress, toxins, environmental exposure, whether that's from your employment, whether you work around in high environmental stress or toxins, or whether you're in the military and you're on deployment and you're out somewhere. And then just being out there, first responders, whatever the case may be, you're out on oil rigs, whatever your exposure is, pest control, right? Environmental exposures. Um, Not wearing gloves and cleaning products, our food. There's so many environmental exposures. The list goes on and on, okay? Recognizing decline and restoring balance. Early signs, persistent fatigue, slower recovery, body changes, fat gain, muscle loss, okay? Mental effects, brain fog, mood changes. It's just going to keep going downhill from there, especially the more weight you gain, the more you start drinking and smoking, the more energy drinks. Don't get me started on my energy drink spiel. That's another thing we got to work on too. Testosterone decline is not written in stone, it's written in choices that, when made consistently, restore vitality. So remember, you didn't get to low T overnight, okay? So especially if you're wanting to work on restoring it naturally, you're going to have to understand that those choices take time. Losing weight takes time. Good supplementation, working out, building muscle take time, okay? So you have to think about those things, you know? So remember, restoring balance and harmony takes time if you're wanting to do it, you know, the integrative way, the natural way, okay? Lab testing and male hormone health. Don't guess, test, okay? Always get a baseline. In fact, especially if you're going to actually truly use testosterone or enclomiphene or gonadorelin, you're going to have baseline labs, okay? It's always good to know where you're starting at. Symptoms without labs just tell half the story. A lot of times fellas don't have labs for several years. You need to have your labs, okay? Remember, timing matters. We talked about that. Essential labs: Total T, Free T, SHBG, LHFSH. We've got a couple other labs that we need to talk about that come up right here. So you've got your hormones, right? And your estradiol, we want to know your estrogen levels. The pituitary markers, these help us distinguish whether you have primary or secondary hypogonadism, okay? There's a few other things we want to rule out when you're coming in and complaining of low energy. I don't feel quite right. Maybe you haven't been to the doctor in a few years and haven't had lab work. Sometimes fellas haven't been to the doctor, if ever, you know? We need to check your thyroid, your master gland, your metabolism center. We need to check your blood count, make sure you're not anemic, you know, your CBC, make sure all of that's good. Your metabolic panel is important, your liver and your kidney function, your lipid panel, your glucose, make sure you're not diabetic, all those things. Now, we're not going to check your fertility and your semen analysis in our practice here. We're not making babies. If you go to a fertility specialist, they would do that, right? But we're not going to be doing that. So just be mindful of that. Now, if it's appropriate, if we're doing more integrative, if we're doing more of a workup and we're doing more autoimmune, you know, during our consultation process, we may check other labs like ferritin and vitamin D and those other things. But these will be our core baseline labs right here, okay? You know, this brings up a good point. If you take biotin can skew some testing results, so you may want to withhold from that. So those are some things to think about. And when you start testosterone, these are just some tidbits on when to retest, depending on which route of treatment depends on how often we're going to retest your labs, okay? Whether you do enclomiphene or true testosterone, that's going to decide when we're actually really going to retest your labs, okay? So we talked about labs. Labs are important. Oh, your PSA. Did we talk about PSA? We have to know your baseline PSA, okay? 55 and up club, fellas, you have to have your PSA checked, okay? It's part of your preventative screening for prostate cancer, especially if somebody in your family had prostate cancer, even younger. Now, I want to talk about this because this is important. Testosterone does not cause prostate cancer, but what testosterone can cause is an increase in cell growth, okay, of abnormal cells. So if there are abnormal cells in the prostate gland, okay, like benign hyperplasia of the prostate, which more than half of all men get over the age of 60, 65, you have to get your prostate checked anyways, okay? So that's why we monitor the PSA. When you start testosterone, and then quarterly or 6 months at least after you start testosterone, every 6 months at least, okay? If it jumps, more than 1.4, 1.5 in a quarter or 6 months, then we're going to refer you to a urologist just to make sure everything's good. And if you've never been to a urologist, especially if you're in that 55 and up club, you need to go. You would go anyways, even if you weren't on testosterone. So think of it, it's part of your preventative screening process, even if you weren't on testosterone, okay? And so then reading your hormone map, right? So labs are important, but they're only useful if you know how to read it. Your provider will help you go over that. Now, also know we offer Dutch hormonal testing. That is way more complex, and that will be covered in your actual personal consultation if you're interested in that. Just know that it is if you can see it, it's a 24-hour urine and saliva testing collection, and it tests your levels for a full 24-hour period rather than just a blood sample of a snapshot. Okay, so we could talk about, a little bit more of that during your consultation. It's a little bit more comprehensive. And it's for those, it's for those that want to really look at the entire picture over a 24-hour span, and especially when we're looking at the adrenal glands, okay? Now, natural optimization strategies, okay? We talked about this, especially if you're a little bit on the younger side, you haven't hit andropause. What is andropause? Andropause is the male version of a female's menopause. Just like women get menopause when they get close to 50, 55, men get an andropause when they get close to 50, okay? And their hormones start slowing down, okay? So their testosterone normally goes down, okay? So younger men, with a secondary hypogonadism that want to increase their testosterone naturally and increase that LH and that FSH firing, and we can do that through natural optimization with an integrative consultation and coaching. That is what I'm here for. That is what we do here at Bellamun. It's one of the programs that we offer with our coaching, okay? If you want more concierge services, we have packages for that. If you want more like monthly or bi-monthly coaching, otherwise just know that you will get support, and you will get a treatment plan, and you will get the male optimization program when you sign up. And you will get an accountability sheet, and you will get a check-in with your provider every 2 to 3 months, and unlimited messaging system, okay? But natural optimization strategies are going to be weight training. You need to lift. You need to build muscle. You need to sleep. Sleep is very restorative for the body, and you need to sleep through that 2 to 3 a.m. cortisol spike that their body tries to wake them up. So we need to get you some good sleep, some good supplements, and we'll go over that during your consultation. Nutrition, we'll go over that too. Okay, so when you sign up for your services, you will get your hormone optimization program that will go over the nutrition and the supplements that you should be taking. But here are a few listed right here for you that are important for good testosterone production and support. Okay, muscle is medicine and training is prescription. Testosterone needs muscle, and estrogen, which is counterproductive to your testosterone, thrives in adipose and fat cells. Okay, so you got to get rid of the fat. Cardio is good, don't get me wrong, but you can't only do cardio. And muscle will burn fat as you're building muscle. So lift, you must lift. Okay, mastering the fundamentals. This is just putting it all together, right? Stress management, chronic cortisol suppresses testosterone. Practice recovery daily. Okay, I understand men might not want to go to yoga and do all the things that women might do, but find what works for you. Maybe you enjoy going for a massage. Men like to go fishing, I know, right? Maybe having sports is good. Going to the brewery every night is not the solution, because excess alcohol also increases estrogen. And that is going to not be counterproductive. So that is not the way to lower your stress. Okay, you're going to have to find other things. Okay, reduce your toxins. Right, there's excess alcohol. Small changes matter. Energy drinks, you got to reduce those energy drinks. They cause electrolyte imbalances and they're dehydrating you. Okay, emerging science, peptides like kisspeptin show promise. Foundation first. Okay, the real edge comes from mastering fundamentals. Okay, you should be on a multivitamin, a men's multivitamin. There's a freebie right there. People are missing out on their nutritional deficits. Okay, Module 5, TRT and medical interventions. Lifestyle is foundation, but sometimes medical conditions are necessary. Sometimes men need testosterone, especially if you are at andropause. If you are a middle-aged male, you might truly need your testosterone replacement therapy, okay? And so there are options and different delivery methods for that, okay? So the goal is to bring back the man to a functional, healthy level where he can feel like himself again. We know that men feel better on testosterone. They sleep better, they have less depression, they have better bone density, they have better libido, they have more energy, they're more likely to exercise. Just men do better. They have a lower risk of cardiovascular disease, contrary to what they may tell you out there. But they have to be willing to keep everything else in alignment. They're not going to have lower cardiovascular disease if they're also diabetic and have all these other things going on. Okay, so you have to remember those things. You have different delivery methods when it comes to testosterone, and those are going to all be dependent on the individual. Not one right way is right for everybody. Okay, you have IM injections. You have topical options. You have to think about fertility impacts. There's different things to think about, okay? You also have sub-Q injections with the sub-Q needle. The thing about that is it's harder to draw up out of the vial because it's usually compounded with an oil. So, we'll have to go over that on how to draw that up with the thicker needle and then put the other needle on, and we'll go over all that, but that is an option. You'll have to inject more frequently if you're going to do sub-Q 2 to 3 times a week, whereas IM, you can usually get away with once a week or twice a week injection. Topical applications. Topical applications are good for our fellas that have thicker necks or that are prone to sleep apnea. You would apply your topical compounded testosterone first thing in the morning after your shower. If you do it then, you are less likely to transfer it to your partner. Okay, you will hear stuff about transference. Yes, it can rub off on your partner. You can put it in the inside of your armpit or your bicep. You just have to be careful. You don't want it to rub off on your partner or your children, because that could happen. But if you do it first thing in the morning after your shower, the likelihood of it rubbing off on somebody later in the day is quite low. Okay, you're going to hear people say variable rates of absorption. In Ayurveda, which I'm an integrative practitioner with a background in that, we use topical routes of delivery in the Eastern world all the time. It's a very overlooked delivery route in the Western world. Okay, it actually works quite well. And whenever men come to get their T levels checked in the clinic and they've used topical routes of delivery, their numbers are actually quite good. Okay, so topical is actually pretty good route of delivery. Okay, and then okay, we're going to continue this. I had to pause that for a second. There was some background noise. So just remembering, now we're moving into sexual health. We're not going to get into this because we wanted to wrap this up. Just know that I wanted you to have an overview of some of this. When we talk about testosterone replacement therapy and fertility is a consideration, just know that true testosterone will shut down sperm production the longer that you're on it, because it shuts down the HPG axis. Okay, so if you're wanting to preserve fertility and you still want to take true testosterone, you're going to need to add an enclomiphene or an HCG or a kisspeptin or a gonadorelin with it to preserve your fertility. Okay, or just take an enclomiphene route and make healthy lifestyle choices. But sometimes fellas, I know, really want the testosterone because they're also wanting to try and build muscle and get their levels up and be in the gym. Okay, so we talked about those things, and really the main other thing I wanted to touch on is with testosterone therapy, the importance of labs, quarterly testing of labs, and then also at least every 6 months, but really quarterly is best, not just for that PSA, but your hemoglobin and hematocrit is important, and your estradiol levels, because if your estrogen gets too high or too low, you can start having symptoms like a menopausal woman being weepy, being moody. You can have low libido. You can even get erectile dysfunction symptoms. So those are things that we do not like. There are some supplements that when you start your testosterone therapy that you can go ahead and take to help keep your estrogen in check, and we will go over that in your consultation. And then your hemoglobin and hematocrit. Okay, so if you will take an omega-3 fatty acid every day, which has numerous other great cardiovascular and metabolic health benefits for you while you take your testosterone therapy, it will help keep your blood a little bit on the thinner side, because testosterone, just like it can cause the increase in cells with the PSA, it can cause increase in blood production. Okay, so that's why we keep an eye on that. Okay, so what are some contraindications and precautions with testosterone replacement therapy? Okay, cardiovascular disease. Okay, especially uncontrolled cardiovascular disease. It's not a complete no for me, because we know men do better with testosterone. It's just you have to be aware that your blood pressure really should be controlled. Prostate cancer, any sort of cancer within the last 2 to 5 years probably needs to be have some sort of clearance or remission from your oncologist or urologist. And again, it's not a complete no. There's actually more and more studies coming out that cancer patients do better with testosterone because they don't want you to have muscle wasting, and they don't want you to lose your energy and your muscle mass. So again, it's not a complete no. It's just let's get the clearance, let's get the okay from your doc, okay? And again, those are things, right? Like get the urology clearance. Let's just, have a chat about those things. Let's just be smart. Fellas are coming in at 60, 65, 70 years old wanting testosterone, but have never gone to a urologist, never had their PSA checked, and then, kind of have to be the bad guy and be like, hey, you need to go see the urologist. But these are things you would need to do anyway. So let's just be smart on that, okay? So those are the major things. Uncontrolled, sleep apnea. So sleep apnea, we want to make sure everybody's screened for sleep apnea. If you have sleep apnea, it's not a no to testosterone. It's just we might want to choose something besides injection therapy, okay? Because that can cause laxity in your muscles in the throat area. A topical route delivery would probably be better for you. So we just have to be mindful of those things, okay? So we just, everybody's unique and we have to personalize your care. Okay. Would love to work with you. We need to keep this short. We're at 26 minutes. This is a required viewing. If you have not seen this video and you come for your consultation, you're going to have to watch this video before you will be seen. Okay. Because we have to cover this. You have to know a little something before we can chat. Okay. Look forward to meeting with you. Take care now and be well. Take care. Thanks. Bye-bye.